Hello, hi there. So, we're going to keep this conversation moving on because why not, right? And next, we're going to dive into the Department of Health and Human Services. So, the Department of Health and Human Services under Project 2025 has gotten a lot of attention, primarily because it focuses on some pretty controversial stuff like reproductive rights, abortion access, Medicaid spending, and the like. And so I just really want to just do a quick overview of it, dive into some really key things that I think are important, because a lot of the surface stuff around abortion access we've talked about, but I'm going to talk about it again. I want to really dive into kind of what the crux of this is and how it could potentially open up doors that can harm real people and negatively impact real lives. Also, I'm going to talk about some of the gross contradictions in this chapter, because it goes from bodily autonomy to controlling bodily autonomy, and it's pretty evident that there's a whole lot of double standards here. Okay, so hang tight. Let's get going. So the first thing we're going to do is we're going to go through the goals of the Health and Human Services chapter of Project 2025. And then I'm going to come back after we talk a little bit about it, and I'm going to bring on the mic a first-time voter who has some questions of her own about Project 2025 and how it's impacting the lives of college students and young people who are grappling with this stuff for the first time in their voting history. So stay tuned for that. It's going to be a lot of fun. So the first thing, let's just jump right on in. Goal number 1, protecting life, conscious, and bodily autonomy. So on the surface, that seems like it should be okay, right? But the question is, whose lives are we protecting? What conscience are we protecting? And what bodily autonomy are we protecting? Because that all is important when we dive into this. So in the past few months, we have unfortunately heard of some tragic losses of life due to state restriction for abortion care. And we can Google these names. Amber Thurman is definitely one that was tragic, and there's so many others who are unnamed. But when we talk about Project 2025's first goal of protecting life, it really is a slap in the face when we're literally facilitating the loss of life. So let's just see what the mandate states. That the secretary should uphold bodily integrity rooted in biological realities. Well, you know what's a biological reality? Abortion care. A DNC for a failed miscarriage, an incomplete miscarriage. That is rooted in science. Okay? That is a biological reality. Furthermore, from the moment of conception, every human being, now that right there, again, was not Amber Thurman a human being? Because her life was lost due to legislative blocks which prohibited her from receiving life-saving health care. Let's keep going. Abortion and euthanasia are not health care. So let's be super clear. Number 1, the United States does not, in any state, allow for selective termination of life. We don't. Canada does it. Switzerland does it. Some other countries are introducing assisted suicide or human euthanasia. Human euthanasia in the United States is never codified, has never been codified. So putting it in here it's a way to ensure that if the conversation does arise, it's already shut down. Okay, but according to the Heritage Foundation, abortion and euthanasia are not health care. Ironically, you would be wrong, because the techniques used in abortion actually are gynecological practices. It is used as healthcare. Let's keep going. The Secretary must protect American civil rights by ensuring that the HHS programs and activities follow the letter and spirit of religious freedom. What in the ham sandwich are you talking about? That has absolutely nothing to do with civil rights. Religious freedom is a portion of civil rights. The other part of that is autonomy. But that's been taken away as well. So, it gets really messy. It gets real messy, okay? Hang tight. We got more. Furthermore, because we're only on goal 1 right now, we got some more to go. HHS programs. It is important that HHS programs respect parents' basic right to direct the upbringing, education, and care of their children. Yes. And who said that could not happen? But what is not happening is that parents who support their children's gender identity are actually being persecuted. There are state laws, there are bills that are being introduced into state legislatures that will make identifying your child as anything other than their biological sex statutory child abuse. There are bills currently suggesting that parents who allow their children to use hormones or to dress outside of their biological sex have their parental rights terminated. Where are those parents' rights? We don't care about those parents. Goal 2, empowering patient choices and provider autonomy. Again. What about the providers who wanted to provide health care to their patients but had to turn them away? What about those providers and their autonomy? I can only imagine the horror of learning that a patient that one couldn't treat died of a treatable condition based on ideological lawmaking. So let's get going. Healthcare reform should be patient-centered and market-based. I'm sorry, what? Right, because everyone in the United States has the same access to health insurance, healthcare providers, and healthcare access. There are places in this country where one has to travel over an hour and a half. And I'm not talking about traffic. I'm talking about distance just to get primary health care. Only then to not have their insurance accepted, or it's out of network, or they have to pay exorbitant co-pays and premiums and deductibles. But it must be market-based, according to Project 2025. They're so concerned about your health care. They're so concerned about your fetuses and your uteri, but not really understanding that there are people who don't have access to basic health care and who use emergency rooms and ambulances to get to the hospital for treatable conditions. Goal 3, promoting stable and flourishing married families. Okay, so this is a very controversial take for a lot of reasons, because we have 50% divorce rate in the United States. And it kind of vacillates between 40 and 60%, okay? For a lot of reasons. Also, not all families are married, okay? Especially same-sex families because, well, we know how that goes. Families comprised of a married mother, father, and their children are the foundation of a well-ordered nation and healthy society. Once again, that is extremely controversial. It is extremely controversial because there are societies that doesn't exist. And those societies are also flourishing. The other thing, when we're talking about married families, we have to also recognize that you're talking about human beings in those roles. This is an ideological idea. That was redundant, Sasha. This is ideology. You have a father, a mother, some kids, maybe a dog or a cat. But what we are not talking about is the health, the physical health, the emotional health, the psychological health, the financial health of the parties in those relationships. Simply having a piece of paper that says that I'm married doesn't conclude that family is healthy. If that was the case, divorce attorneys wouldn't really have a job for a lot of reasons. And I have my opinions of divorce attorneys, but we're not going to get into that right now. Stay tuned. Getting back to the idea of married families being the only and the preferred, without speaking about the health of that union. 1 in 6 children will be a victim of child abuse. Physical abuse, sexual abuse, emotional, psychological abuse. It happens. Children are more likely to be abused in homes with adult caregivers. It just happens. Although the Heritage Foundation wants to kind of talk about homes with non-related boyfriends present the most dangerous place for a child, okay? Homes with non-biological caregivers. Because that's what the study said. I know where you got this from. Non-married caregivers present the greatest risk of harm. And actually, there is research that children are more at risk with a biological father and a non-biological female caregiver. That has the highest risk of child abuse. But again, it doesn't matter because the father is there, and that's really what we want. And there's nothing wrong with having fathers involved, and most fathers are involved. This is the crazy thing. You don't have to live in the house with your child to be involved. It then goes on to talk about the idea that fathers insulate children from physical and sexual abuse, financial difficulty, and poverty. Well, that's because you probably have another human being in the house who's making money. A lot of the data that comes out about bad outcomes in single-parent homes with mother-led homes have an undercurrent of poverty. That's the thing. It's poverty. The other thing that we don't talk about here is homes that have fathers as the single parent or the parent on record, meaning a court order. Usually, he's not living alone. He's usually repartnered or has mamas and sisters and aunties and cousins and everybody else helping him. The difference is most single mothers are doing it completely alone. And that's the reason why we can swoop in and manipulate these data, because we're not really doing the deep dive. So that data is out there. We don't have enough time for that data, but the Heritage Foundation says that it's best to stay in the house, despite the fact that the health of the relationship is trash. Stay in that relationship because it's better for your children. What could possibly go wrong? HHS policies should never place the desires of adults over the rights of children. However, the United States is the only state of the United Nations to not ratify the Convention for the Rights of the Child. If you don't know what that means, it's basically the United Nations treaty that says that, hey, kids have a right. Kids have rights, and they have a right to live in a home free from abuse. They have a right to have a voice. They have a right to have their wishes taken into consideration. The United States wasn't having all that. They didn't like that part. It's like, how dare these brats have rights? However, according to the Heritage Foundation, the rights of kids should oversee the rights of adults, yet it says the rights of children to be raised by biological mothers and fathers. See? See. It's not really about the rights of the child. It's about the rights of the child according to this ideology. Here's the other part of that gets really, really messy. Biological parents found by a court to be unfit because of abuse or neglect, and once again, remember what I said earlier, states are rapidly codifying everything from allowing your children to wear lipstick as a boy, identify in their chosen gender, or use a pronoun as abuse. So be very careful about that term, because there are things that are statutory. And statutory basically means is that a whole bunch of lobbyists went to the State House and said, hey, this situation right here, based on this data that really hasn't stood up to any rigor, is real, and you need to put this on the books. That's the fear of using these terms, is that it can become statutory. So, once a parent has been found unfit, the process of adoption should be speedy, certain, and supported generously by HHS. Sasha, let's talk about this for a second. Who do you think is going to be the one overseeing these adoptions and these revocations? It is exceptionally hard to revoke someone's parental rights. You can switch custody and all that other stuff. That happens every damn day. But to revoke parental rights, it's very difficult. Unless you have the support of Child Protective Services, who, empowered by statutory amendments to the Abuse and Neglect Code, can make a claim that, yeah, well, mom allowed their child to identify as pansexual. And according to blah, blah, blah amended statute, encouraging a child to identify as something other than their biological sex is abuse. And therefore, yeah, they abused it. This is very scary. And we need to take this very seriously. I know it's very sexy to talk about the reproductive rights stuff, but this is real. This is real. We haven't seen this type of child resettlement, replacement since the first Americans, since Native American schools, when children were taken away from their res and put into these schools run by settlers because they thought the kids were just too uncivilized. Read up on that. That is American history. We don't want to talk about that American history, though, because that DEI stuff, I talked about that back in the Department of Education with critical race theory. They don't want to talk about this either. Yeah. Native American children were forcibly taken from their homes on the reservations and placed into schools to resettle them, to reculture them, to acculture them. Because if you have kids using their own brains, what could possibly go wrong? And the final goal of the Health and Human Services portion of Project 2025 is to prepare for the next health emergency. Because what in the ham cheese happened during COVID-19? And I agree, yes, we need to be better prepared. That was insane, right? It's like, so what are we going to do, right? They're going to save us. Actually, they said basic human rights and medical choice. I'm sorry, Sasha, we got to keep it classy. Basic human rights and medical choice. That basically means that, hey, I don't want to take a vaccination because I don't, and I shouldn't have to. But I'm also not going to wear a mask, and I'm also going to go out in public, and I'm also going to live my life because I got human rights to do. I have basic human rights. But Amber Thurman doesn't have basic human rights to health care. In the section about the Environmental Protection Agency, I talked about diversity of scientific thought. While this is not as scientific laden as the Environmental Protection Agency, when it comes to stuff like this, it kind of is, because what they're basically saying is that, well, some researchers might have a different opinion, and those opinions that we agree with are the ones that we should go with. What could possibly go wrong when we're making decisions that do not align with science? The Tuskegee experiment, anyone? I'm not laughing. I'm laughing out of sheer frustration. But yeah, this is what Project 2025 wants us to do. We have the next medical emergency, global health pandemic. The way we're going to handle it is we're going to let people make their own decisions. What could possibly go wrong?